Hi, everyone, and welcome to this dialogue with the Africa Centers for Disease Control and Prevention. My name is Chris Collins, and I'm with Friends of the Global Fight Against AIDS, TB, and Malaria, based in Washington, D.C. We had originally planned to speak with Dr. John Nkengasong, Director of Africa CDC. Unfortunately, just in the last hour, he's been called to a high-level meeting, but we're very pleased to have Dr. Tajudeen Raji, Head of Division, Research and Public Health Institutes at the Africa CDC. This is the third in our Friends Health Chat series with leaders in global health. During today's discussion, we'll learn from Dr. Taj about how COVID-19 is affecting communities in Africa and look at the role of both domestic and global efforts to help communities respond. I'll ask Dr. Taj questions for about 30 minutes, then take your questions from the chat box for another 15. If you have a question, please do type that into the chat box at any time. As you know, Africa CDC has provided really extraordinary leadership throughout the COVID-19 pandemic, promoting evidence-based policies and reminding policymakers in Africa and around the world about the urgency for action. Dr. Taj is currently head of the Division of Public Health Institutes and Research at Africa CDC, based in Addis Ababa, Ethiopia. There, he coordinates the establishment and strengthening of national public health institutes across 55 African Union member states. He oversees the establishment of the 5 Africa CDC regional collaborating centers in Lusaka, Abuja, Libreville, Nairobi, and Cairo. Dr. Taj also heads the Healthcare Preparedness and Countermeasures section of the Africa CDC COVID-19 response and co-chairs the Case Management Technical Working Group of the Africa Task Force on COVID-19. Dr. Taj, thank you very much for being with us today.
It's a pleasure.
Before we talk about the situation in Africa, can you tell us a little bit about your background and how you got engaged in this work?
All right. Thank you, Chris, and thank you, colleagues, for joining this webinar. So, first and foremost, I'm Raji Tajudeen from Nigeria. And as far as this work is concerned, I've been part and parcel of the journey of Africa CDC since it all started 4 years ago. I was also privileged to be part of the meeting that led to the conceptualization of the idea to have in place in Africa a foremost public health agency that will be able to drive and address the public health needs of the continent. And by way of academics, I'm a medical doctor with a postgraduate specialization, first in pediatrics, then in public health. And since the inception of Africa CDC, I've been at the aim of affairs as far as strengthening health systems across the continent is concerned. I've also been driving the public health workforce agenda on the continent and oversee the research agenda for the Africa CDC as well. Over to you, Collins.
Okay, great. Thank you. Well, let's get into COVID-19 and how it's affecting Africa. For much of the last year, we heard that COVID-19 was manifesting less severely in Africa than in many other parts of the world. There was only limited media coverage on the indirect impacts of COVID on other areas of public health programming or the harsh economic effects of the pandemic. Now we're hearing a much more deadly second wave is hitting the continent, and a viral mutation in South Africa is worsening COVID-19 there and perhaps other places. So where do we stand in terms of the impact of COVID-19 in Africa, both direct and indirect? And what will you be looking at most closely in the coming months to gauge how well the pandemic is getting under control on the continent?
All right, thank you, Chris, for that question. So let me take you a step back to 4 or 5 years ago when we had the Ebola outbreak in West Africa. If there is anything we learned as part of lessons from that Ebola outbreak in West Africa, is the fact that we should not lose sight of the indirect impact of whatever epidemic or pandemic that is ongoing. So right from our inception for Africa CDC, we did realize that we needed to pay attention to those non-COVID issues as far as this continent is concerned. Today, in terms of the direct impact of this COVID-19, as against the first wave, we begin to see more deaths with the second wave. We are seeing our healthcare facilities being overwhelmed. We are seeing those critical interventions, especially oxygen, running out of supply. We are seeing a lot of our member states having to prioritize between who should be admitted, who should not be admitted. So all these have been affected. And of course, whether we like it or not, those routine health services like maternal and child health, routine childhood immunization, TB, malaria, HIV, and so on and so forth, those programs will also be affected, because once the health systems are getting overwhelmed, surely those other routine care will be affected. Again, when you also look at other non-COVID issues, for instance, the schools are closed, and we know that already we are at disadvantage point as far as education is concerned. So this COVID-19 is further widening that inequality as far as education is concerned. We know that before COVID-19, we have had in place a lot of poverty alleviation programs. So a lot of progress has been made in that regard before this COVID-19. So with COVID-19, most of this progress has been eroded. You will agree with me. If you also look at a lot of development projects, because as Africa CDC is sitting within the African Union, we have what we call the African Union Agenda 2063, which is a socio-economic blueprint for the continent. Before the COVID-19, we were making a lot of progress. So with COVID-19 now, most of those progress has been stalled. So whether we like it or not, there's a lot of direct and indirect impact as far as this COVID-19 is concerned. And then, in terms of what do we perceive as being, a progress, or being able to have control the pandemic on the continent. First is, how do we effectively reduce the number of deaths that is currently happening on the continent? How do we ensure equitable and affordable access to these critical medical supplies? For instance, most of our member states, especially in Southern Africa and the Western African part of the continent, are in critical short supply of oxygen. So we need to begin to look at equitable and affordable access and supply of this oxygen, so that we'll be able to reduce significantly this number of deaths. We are also looking at vaccine. Today, most part of the world have rolled out vaccine. For Africa, we are still on the road to doing that, and we don't even have dates yet. So again, we want to see equitable and affordable access to COVID-19 vaccine, not only in terms of supply, but to see the community taking up this vaccine. And again, we also want to see most of those routine healthcare services like TB, HIV, malaria, maternal and child health, continue to be run concurrently as we are responding to the COVID-19. This program also continues to be run side by side, but ensuring that these services are actually run safely. And last but not the least, we want to see safe reopening of our economy and safe reopening of schools. Over, Chris.
Yeah, thank you. And what can you tell us about the viral strain that has been emerging in South Africa? It sounds like it's related to faster spread of the virus there. What's the latest on the new strain from South Africa?
Well, all right. Thank you, Chris. Of course, it is no longer news that we have a new strain in South Africa. We have in the UK. Of course, we also have in Brazil. And this is really, really of public health significance. Of course, we now know that is the predominant strain behind the rapidly increasing cases in South Africa and the surrounding member states. In terms of latest, we know that it has actually moved beyond South Africa now. It's been reported in some other member states. Those member states surrounding South Africa, like Zimbabwe, like Zambia. Of recent, we also have information that Mozambique has also reported cases. Eswatini, just yesterday, we had information that Gambia in West Africa has also recorded some. So it is no longer news. I think it's virtually in most member states now. So in terms of latest and what Africa CDC is doing, before even the emergence of this new variant, Africa CDC launched what is called a pathogen genomic initiative, whose emphasis is to ensure we have a very strong and robust molecular surveillance, strategy as part of our continental-wide COVID-19 strategy on the continent. So what we have done in terms of this emergence of new variant is to step up that genomic surveillance so that we're able to track exactly what is happening as far as the spread of this new COVID-19 variant on the continent is concerned. And we are assisting members to build that capacity, to be able to track this new variant and respond as appropriate in terms of the public and the social measures that we have put in place. And as a continent, one of the first things we did was to actually convey a meeting that brought together all the member states to understand what is this new variant, what are the clinical implications of this new variant in terms of the spreading. We now know that in terms of transmissibility is easily transmissible, highly contagious compared to the original variant. And of course, we also know that those same public health and social measures that were applicable to the first or the original variant is still applicable to this one, and it's amenable to that. So as much as possible, we continue to emphasize on the need for our member states to continue to practice those same non-pharmaceutical countermeasures, where we try to understand what exactly, what next will happen as far as this new variant is concerned. So I can say that we have it well covered as far as the continent is concerned. Over.
Yeah, thank you. Several weeks ago, Dr. Nkengasong said it would be a moral catastrophe if COVID-19 vaccines aren't widely available in Africa while other countries roll them out. Can you tell us a little bit more about the status of plans for COVID-19 access and delivery on the continent? What could speed access to vaccines, and what's needed to make sure marginalized and poor populations in African nations have access?
All right, thank you so much, Chris. I think this is one aspect of the COVID-19 response that I think we should know that it's all about equity, and it's all about moral responsibility. It's also all about human rights, as articulated by John in some of his past interview. So in terms of responding to COVID-19, what we did first as a continent was, one, to leverage on the political support on the continent. As you know, Africa CDC is a technical institution that sits within a political organization. So as far back as June, we did enlist the support of our leadership under the presidency of President Cyril Ramaphosa of South Africa, and with that, we're able to put together a continental strategy for COVID-19 vaccine, which is underpinned by three key pillars. Now, what we have seen, let me fast forward that. What we are seeing now is that we've now seen that quite a lot of the high-income countries now have access to vaccine. In fact, some have oversubscribed beyond what they actually need. And we also know that up to this moment, vaccine is yet to be deployed at the scale that one expects in Africa and other low and middle income countries. In fact, to be more specific, today is only Seychelles that's deployed COVID-19 vaccine on the continent of 1.3 billion people, So I think for me, in terms of what we need to do to accelerate this process, to make sure that Africa does not stay at the back of the queue or does not wait for what will trickle down at the end of the day, is one, to fast track the process that have been set or that have been put in place to the COVAX facility, where we are expected to get 20% of what we need. I think that really need to move with the necessary speed. Number two, as a continent, we also have a complementary plan to the COVAX strategy. Again, we are calling on partners to support us on this initiative. So we've put in place a strategy that will allow the 40 to 50% gap, because we all know you need 60 to 70% on the minimum to have what we call herd immunity, or to have sufficient coverage that will be able to bring this pandemic under control. COVAX is going to give us 20%. We still have a gap of 40 to 50%. And we know that it's really, really capital extensive. So we're calling on all partners to support on this. We've done some quantification. We've done some cost estimation. We are looking at something in the range of 10 billion USD, because we need close to 1.5 billion, to give two shots to a continent of 1.5 billion if you have to cover 60 to 70%. So in terms of that, I think we also need a lot of partners to come through to support this initiative. On our own, through the Assembly of Head of State and Government, we have been able to secure close to 270 million. And this is targeted at the most vulnerable group. The frontline healthcare workers, those who are elderly, those with background medical conditions, But again, you agree with me that this is not enough. So there is still a long way to go, and this is capital intensive. So we're calling on Friends of Africa to come through, support this. Not only that, I think we also need to be looking at how do we use this opportunity to strengthen local capacity in terms of manufacturing. How do we use this opportunity to emphasize on the need for technological transfer, so that when the next pandemic comes on board, we are not going to start calling people outside the continent to assist. At least even if we are going to call them, it's going to come as a very last resort. We will be able to start something on our own. So let me stop there and hand over back to you, Chris. Over.
No, and that's really interesting too, that I think really important for all of us to be thinking about, and maybe we can talk about it in the future, is how we need the immediate response in terms of various tools, but we also need to be thinking about how to get those out in a way that lays a foundation for stronger systems down the road. So I think that's more to discuss there. You've talked about vaccines. What other tools in addition need to be scaled up to address the immediate public health challenge, help countries reopen safely, and pave the way for vaccine delivery one day? For example, Dr. Nkengasong had noted in the past that a rapid diagnostic test scale up could be a game changer. So beyond vaccines, what else does Africa need now, and why? And what could be the role of the Global Fund and other multilateral organizations in that?
All right. Thank you again, Chris. So beyond vaccine, we know that there are a couple of things that are needed. Vaccine is not a silver or a magic bullet. Even for vaccine to take effect, as far as controlling the pandemic, it will take some time. By prediction, it will take us close to 2 years to get to that 60-70% coverage. So in terms of immediate and critical need, we need to stop this rapidly increasing death as far as COVID-19 on the continent is concerned. As I said, our health facilities are getting overwhelmed. And one of the very, very critical interventions that will stem this tide of rising death on the continent is availability of oxygen. A lot of discussion has started, but none has really come true. So we call on those big the donors, the manufacturers, this is a time for them to support the continent with oxygen, medical oxygen, very, very critical. We believe with oxygen, we'll be able to reduce the death. Today, we are seeing a lot of healthcare workers' infection on the continent. One, because of shortage of the personal protective equipment. Two, because our facilities are getting overwhelmed. So we need the personal protective equipment, gun, gloves, masks, and so on and so forth, by way of supporting our local manufacturers to be able to produce at scale, and also to import some of these things through the various platforms, one of which Africa has nicely put up. That's the Africa Medical Supply Platform. Another thing is even the facilities. How do we get things like field hospitals, so that with this we are able to, expand the facilities, so that the few ones that are available does not necessarily get overwhelmed. Number three is workforce. I think we also need a lot of support in terms of building the capacity on the continent. One thing that Africa Cities has been able to do is to support some member states with community health workers. We believe that if you're able to identify the close to 80% of our cases that are really asymptomatic, mild, and moderate before they get severe, I think we'll be able to prevent this the way our healthcare facilities are getting overwhelmed. And the way to do this is to deploy community health workers at scale, so that right from the community they are able to pick out these cases before they get very serious. So if you can get partners on board to support us as part of this our community health workers initiative, we believe that this will go a long way to support us to bring this pandemic under control. So none of all these I've mentioned, we see the light of the day without adequate finances. Again, so this is where our partners are coming. You don't need to give us the money, but you can support some of this vision that Africa CDC has channeled forward, so that at the end of the day, we have this COVID-19 pandemic under control on the continent. Over to you, Chris.
Great, thank you. Yeah, the Global Fund has helped over 100 countries so far with things like oxygen therapeutics, diagnostics, PPE, supporting healthcare workers, and addressing that damage to HTB and malaria programs. But it has now run out of money to provide the COVID-specific help. So, a really important role for donors there in terms of the Global Fund being able to help with all those things you named. Well, the Global Fund's been doing regular surveys during COVID-19, and it's consistently finding that over half to 2/3 of HTB and malaria programming is experiencing moderate to severe service disruption because of the pandemic. In fact, we stand to lose a decade or more of progress on these epidemics unless we do something to shore up those programs. What do you see? How real are the ongoing risks of COVID-19 to HTB and malaria and immunization programming? And conversely, have you seen examples where HTB and malaria programs and personnel have helped with the COVID-19 response?
Thank you, Chris. I think, as I mentioned earlier on, one of the lessons we learned from Ebola outbreak in West Africa is the fact that if we are not careful, the same number of deaths that will be recorded from COVID-19 pandemic, the same number of them will come through if we don't pay attention to these other endemic diseases like HIV, TB, and malaria. And one thing Africa CDC is trying to do right from outset is to make sure that our member states will continue to engage them on the need to continue to run these essential health services, in order for them not to lose sight of those services. And at that time, to also try as much as possible to emphasize this to partners, that please continue to support these other programs, TB, malaria, HIV, maternal and child. Because we saw it live in West Africa. More than 11,000 people died from Ebola. Much more than that number died from this other lack of these other services. So we did not want that history to repeat itself. So as much as possible, we continue to emphasize that. And now that our health systems are getting overwhelmed, what we're seeing is that quite a lot of member states have actually prioritized the COVID-19, so whether you like it or not, some of these human resources that actually attend to some of these programs have been moved to respond to the COVID-19 as an immediate need, So, but again, I think emphasis will still continue to be made on the fact that the Global Fund should not get tired. I think they should continue to make available resources to continue to run these programs, so that at the end of the day, as you rightly mentioned, we do not erode the progress that have been made over years. Because a lot of modeling are coming true that if we are not careful, the COVID-19 pandemic will take us to where we are as far as the HIV, TB, and malaria is concerned in 2010, meaning that 10 years of progress will be eroded, and we do not want that to happen. So I think as much as possible, resources for this control of these endemic diseases should continue to be available. We need to continue to scale up our the public health workforce capacity, health workforce capacity in general, so that this program continue to be supported. And of course, we are also emphasizing on the need to deploy technology So that, because we believe that with teleconsultation, with telehealth, you are able to make sure that some of these services could be run very safely without really, exposing anybody to the risk of COVID-19 infection. And we are also able to follow up all most of these cases who are actually chronic conditions, that just need somebody or a system that is responsive to the healthcare system for them to be followed up and make sure that the medications and the different interventions they receive continue to be run concurrently with the response to the COVID-19 pandemic. Over.
Great, thank you. Yeah. I want to come back to something that you raised earlier and see if we can talk about it a little bit more. If the world has to marshal a robust and equitable response to COVID-19 in every continent, and including Africa, and how is that response, if we can get it right, an opportunity to come out of this pandemic in a stronger position in terms of building resilient systems for health? What do we need to be thinking about now to come out of the COVID-19 disaster in a stronger way in terms of health system?
All right. Thank you so much, Chris. I think in the course of my training, one thing that is always emphasized is that we should not waste a crisis opportunity. So COVID-19 pandemic has shown us how weak our health system. We know before that the health system is weak, but to what extent may be something that may be not very clear to us, but at least we know how vulnerable our healthcare system is, So if after there's anything COVID-19 has demonstrated on the need for us to strengthen our healthcare system, on the need to put in place a robust infrastructure. It also emphasized on the need to build local capacity, for instance, in terms of medical supply. Things like masks, things like gowns, things like gloves, these are things that as Africans we should be able to, to produce locally with the right support. Again, we call on partners to invest in this. In terms of diagnostics, this is also something that we need to come up with innovative way of making sure that we are able to produce some of these on the continent. We have a lot of research institutions on the continent. I think what is just lacking is the necessary resources, especially financial resources, transfer of technology, appropriate training, for those our staffs. So with that right support, I think we can build our local diagnostic capacity. The other thing we also want to see happening is how do we ensure that the US CDC equivalent, the Public Health England equivalent, China CDC equivalent, how do you have similar institutions on the continent so that when the next pandemic or epidemic outbreak occur, before we even call for help, on our own, we're able to deploy, some of these resources to respond, So these are some of the things I think one will want to continue to emphasize. And last but not the least, I think primary healthcare system, very, very important. I've highlighted the importance of deploying community health workers at scale, Of course, training is very, very important, to this. For instance, if we look at the epidemiologists on the continent, today as a continent, we need close to 6,500 epidemiologists. What we currently have on the ground is 1,500 to 2,000. So we need an innovative way to scale up the rollout of these epidemiologists, So I think, again, we need the support of partners to support Africa CDC. We have channel division, but we cannot do it alone. We need all the support to make sure that we are able to come up with innovative way of training, and then rolling out this support as far as the continent is concerned. Over to you, Chris.
Great, wonderful. Well, before we go to questions from the chat box, and we have a lot of questions coming in, so that's great. People are really impressed with your presentation here, but I would just say I want to call out again the tremendous leadership of Africa CDC through this whole nightmare of COVID. Just really been highly visible around the world in terms of your focus on evidence-based and strategic approaches. So thank you so much for what you and Dr. Nkengasong and everybody else are doing there. It's really
Yeah, most welcome, Chris.
it's really a beacon for the rest of the world, really, to follow your lead. Let me start. There's a lot of questions, as I said. Why don't I ask you a couple, and then you can do two at a time. Is that okay?
Yeah, fine.
So here's the first. Thank you for the excellent presentation. Do you feel that African countries have sufficient availability of COVID testing materials? And are laboratory systems currently sufficient to support the level of testing that is needed? That's the first question. And the second one comes from David Bryden. Strikes by health workers are widespread. Kenyan nurses have gone unpaid for 4 months and are on strike to demand payment, more staffing, decent conditions. What more can we do to address the needs of health workers to respond to COVID? So those two for you.
All right, thank you. So let me start with the testing. Of course, we do not have adequate number of tests on the continent. But looking at where we are coming from and where we are today, I can say that significant progress has been made. In February, before the continent recorded its first COVID-19 case, there was no single lab on the continent that could diagnose COVID-19, that could diagnose SARS-CoV-2. You know, the first case on the continent was recorded on the 14th of February, year 2020. At that time, there were only 2 labs on the continent that could test for COVID-19. That was South Africa and Senegal. So with the support of Africa CDC, we were able to rally other partners to train the different labs across our 55 member states. Today, I'm glad to inform you that there is no member country that does not have the capacity to test for COVID-19. Those countries without PCR capacity, we supported them with what it takes to use gene expert machine. We repurposed the gene expert machine to make sure that they're able to carry out this the COVID-19 test in their member state. We also make sure that cartridges to use this gene expert machine were made available. And in terms of scaling up testing, we also launched an initiative sometimes in April, called Partners to Accelerate COVID-19 Testing on the Continent. This was at the time that our whole continent, we were doing less than 400,000 tests for 1.3 billion population. Today, we have surpassed 30 million tests on the continent. So meaning that we may not be where we want to be, but we have come a long way and a lot of progress has been made. Of course, we continue to work with partners to continue to build the capacity of member states. I will continue to also emphasize on the need to have a local manufacturing of this diagnosis test on the continent. But that's the only way we can guarantee our own security. I will continue to emphasize that. So a lot of discussion is ongoing as far as that is concerned. Now, on the issue of workforce and welfare, of course, you agree with me that it is a big issue as far as the continent is concerned. One, in terms of number, we do not have adequate, the workforce capacity is not adequate. And in terms of welfare, it's also not where we want it to be. In fact, this is some of the reasons why we have the so-called brain drain, But this is where we call on our partners, to support us in terms of one, training, using all the innovative tools one can think of to make sure that we have this adequate we have adequately skilled manpower as far as the continent is concerned. And of course, we continue to emphasize to our member states through the political platform that has been provided to African Union on the need to continue to improve the welfare, of the health care workers on the continent. We've made some progress, but still there's room for improvement. Over.
Okay, thank you. Great. I'll give you two more questions here then. This is from Elizabeth Abu. Is there collaboration between the various sovereign countries on the way forward, data collection and research capabilities? What is the African CDC doing to bring countries at par on research throughout the various countries in Africa? And then a question from Mark Castellano. The U.S. has rejoined the WHO and intends to participate in COVAX. What specifically can the U.S. Congress do to better support healthcare and fighting disease in Africa?
All right. Thank you. Thank you so much. So let me start with the first one. I think if there is any aspect of our response, that's really led to the significant success that we have achieved as a continent, is that of coordination. A week after the first case of COVID-19 on the continent was recorded, the African Union and the African CDC brought together all the ministers of health across the 55 member states. One, to agree on the continental strategy. Two, to agree on the task force that would drive that continental strategy. And that meeting did emphasize, one, coordination, two, collaboration, three, cooperation, four, communication. So this has been our biggest strength. And up to this moment, as I'm talking to you, we continue to have a regular platform where John Nkengasong briefed the highest leadership on the continent under the leadership of President Cyril Ramaphosa. So that has led to very, very big and a very strong coordination as far as our COVID-19 containment strategy is concerned. Now, specifically on our research and data sets. So as part of the task force, we actually came up with technical working groups that was like looking at the different thematic areas as far as the responses are concerned. For instance, on research, there was a technical working group that is looking at science standard and regulation. So with this technical working group, they're able to bring together all the research, the research experts across our member states. And we did, if we all recall, at the outset of this pandemic, WHO did put together research priority as far as the COVID-19 pandemic is concerned. So when we came back from Geneva to Africa, we did convene a meeting involving the African Academy of Sciences, the different partners, WHO, and so on and so forth. Try to understand those WHO areas of, priority areas, and look at what is it that is priority for us as a continent. And collectively, we did agree on some set of priority areas. So as far as coordination, research on that aspect is concerned, I think we have it fully covered for Africa CDC. On data collection, that is one area that we seem to be having some challenges at the outset, but I think today we've made a lot of progress, because this is some of the reason behind our ability to really come up with the different data sets. We have our dashboard, and we could actually, look at the trend, and look at where we are going, and we have been able to use that to advise our political leaders on what we think we should be doing. And through that, again, we've been able to come up with a common stand on the way we should respond to this COVID-19 pandemic on the continent. Over to you, Chris.
Wonderful. Okay, thanks.
Sorry, on the second question on the US and the WHO, yes, so I think it's a welcome development that US is back to WHO. Of course, for us, that will further strengthen WHO, and that will also bring the necessary leadership as far as the global health space is concerned. Because whether we like it or not, the US is definitely a leader as far as that space is concerned, and I think one of the critical tools as far as a pandemic or epidemic is concerned is leadership. So we believe that US on board now will bring about the necessary leadership. And in terms of specific support, of course, I've highlighted this, and I'll continue to emphasize that as Africans, we need the vaccine, and we need the vaccines now. COVAX has promised us 20%. If there's any way US can ensure that 20% can be scaled up, because 20% will not earn us the necessary immunity. So if there's any way that can be scaled up, I think that would be a welcome development. We know that some countries have oversubscribed to this vaccine. If there's any way those excess can also come either directly to us as Africa CDC or come through the COVAX facility, I think is one area that we believe US can also work to ensure that Africa get the necessary vaccine. Even in terms of local production of this vaccine, we know that there's a lot of debate, a lot of issues concerning the IP, the intellectual property. We believe that this is space that the US can bring in its weight and, very strongly, to make sure that some of these vaccines can also be produced locally. We have some factories, we have some manufacturers who are ready, to begin to produce some of these vaccines. We just need the necessary support and the necessary transfer of technology. Again, we believe this is an aspect where US can come in and leverage its weight and make the necessary move. Thank you, Chris.
Excellent. Okay, we've got just about 4 minutes left. This has been wonderful, this conversation. Let me throw you 2 last questions and see if you can get them in. Thank you for the great conversation. This comes from PIA Global Health Advocates. You have mentioned the need for strong health systems in order to tackle the pandemic. Where do you see the EU-Africa partnership's role in that? And what are some of the health priorities you hope to see addressed in that partnership? And then the second one comes from Daniel Burton. Thank you for an informative conversation. How important is it to detect disease at an early stage? And how can supporters and businesses play a role? For example, helping with developing new diagnostic tools which can be used at the front line.
All right. Thank you so much. So let me start with the question on the European Union. So, of course, there's no doubt about it. We need a very strong health system, be it to be able to, for early detection of any epidemic outbreak, or for us to be able to bring under control the different endemic diseases like TB, malaria, and HIV/AIDS. So, strong health system, whether we like it or not, very, very important. In fact, the whole idea of having a National Public Health Institute in each and every member state is just to make sure that we have a very strong health systems. But these are, whether we like it or not, very strong institution that can coordinate, and be able to leverage resources from different partners and avoid duplication of resources. So for us, I think it's a top priority, and it's one of the key strategic pillars of the Africa CDC. In terms of what can EU do for us, I think with EU, we're already doing a lot together, of course. There's a lot of room for more, One, we've been working closely with European CDC, to make sure that, we share experience and also to support us in terms of providing necessary technical support. And they have also provided some financial support. And the European CDC is part and parcel of our weekly task force meeting, where they share their experience with us and also help us to build the necessary local capacity. And still on EU, we're also working closely with European and developing countries clinical trial partnership. One, on the aspect of the research agenda for the continent, and 2, on public health workforce development. So I think a lot of work is ongoing in that aspect. And of course, there's always room for improvement. For instance, we're working closely with Robocop Institute to support the COVID-19 pandemic and response on the continent, and also to strengthen our health system. We're working with Sweden Development Agency through their National Public Health Institute to support some of our member states to have in place a National Public Health Institute. So a lot is going on there, but of course, we welcome more collaboration, so that at the end of the day, we're able to have a very strong health system on the continent. So in terms of early detection and private sector, so I think one of the biggest supporters of our response, as far as this COVID-19 pandemic is concerned, has remained the private sector. For instance, with the support of the private sector, at the outset, when we had this critical need for medical supplies, the private sector, working together with the political leadership on the continent, were able to put together what we call the African Medical Supply Platform. And that platform alone ensured that most of our member states had equitable and affordable access to the different COVID-19 medical supplies, ranging from PPE to oxygen, to mechanical ventilators, and so on and so forth. The private sector have also worked, strongly to make sure that resource mobilization on the continent, has also come true, So the continent has been able to mobilize a lot of resources, financial resources to support the COVID-19 response under the, again, leadership of the head of state on the continent. Of course, the private sector have also put at our disposal the different technology. We know that they are the one driving all this, the telecommunication industry on the continent, and we have been able to use some of these platforms to drive our response. So, to cut it short, I think we have really leveraged on the resources at the disposal of the private sector on the continent. And in terms of early detection of disease or whatever, I think is very, very important. In fact, this is one of the reasons behind the Africa CDC community health workers agenda, because we should not forget that these are also surveillance assistants. Whenever any outbreak comes through, these are the first line of defense. They are likely to pick it first. So if they get it right there, surely we'll be able to put some of this pandemic this epidemic under control before it becomes something that is, something that is out of control. So I think the emphasis on early detection is very, very important. And our agenda as far as that space is concerned is to make sure that we have a robust community health workers program on the continent. In fact, our vision is to deploy 1 million community health workers to support this COVID-19 pandemic, and post-COVID to use that to strengthen our, the primary healthcare system on the continent. Over to you, Chris.
Wonderful. Well, thank you for that. We are out of time, but Dr. Taj, I want to thank you and Dr. Nkengasong and everybody there for the incredible leadership in tackling COVID-19 and other health systems issues. So thank you so much. And thank you very much for your time today. This has been a wonderful conversation. Many people have already been commenting about that. The conversation is going to be on our website at theglobalfight.org. I also want to thank Lenice Williams, who was in charge of setting this up and all the technical aspects. She's with Friends of the Global Fight. Dr. Taj, all our guests, thank you very much for your time, and we'll be in touch soon.
Thank you, and it's always a pleasure. Bye.
Bye.